Right, South Africans wait to hear if the President will extend the 14 days of level 4 lockdown. And the fact that the COVID-19 numbers are rising certainly indeed disheartening. South Africa is now sitting at over 2,179,000 cases. So are we likely to see an extension or shifting gears in terms of the lockdown? Let's bring into the conversation Professor Francois Venter from the Ezintsha Research Group at Wits University. Francois, thanks indeed for talking to us. So at the end of the day, I suppose the big question is the numbers. They are not heartening indeed. We're still seeing the numbers high. And as we approach that address from President Cyril Ramaphosa, that's probably the first thing you'd consider as to whether or not these restrictions would be released or eased.
I agree. I think it's very unlikely. Looking at the numbers across the country, when they instituted this 2 weeks ago, almost nothing has changed. In fact, most of the provinces have got a lot worse. The Northern Cape seems to have hit its peak of maybe 2 or 3 weeks ago, and Gauteng is currently probably at its worst. But all the reasons for the implementation for the lockdown, as critical as I might be of them, are still in place. So I doubt we'll see much change this evening.
One good thing, though, Professor, is that we are really seeing a better than expected, I would think, rate on the vaccinations. It seems to be moving fast, but of course one would imagine that's not taken into account when it comes to lockdown now, because the effects of that we only see later.
Absolutely. If we vaccinated every South African tomorrow, the third wave would still tear its way through our country. The importance of the vaccination program is for the fourth wave and to protect us in the time between the third and the fourth wave. It just takes a few weeks for the vaccinations to kick in. We've still only vaccinated 5% of the population, but there's some heroic people on the ground who have accelerated the vaccine program to almost the numbers we need to be getting to. However, we do need to be very worried that the people over the age of 60, still a very small minority, have been fully vaccinated yet, and that needs to be an absolute priority going forward.
And that's a very important point, because as we expand the age band for these vaccinations, you still have the residue from the previous bands, and although it looks good on the ground now, what we don't want is that overlap to occur increasingly. Am I right?
That's absolutely right. The problem is that we see this in other countries as well, is the people at the front of the queue will stand through snow and sleet to get their vaccine. You have to work a lot harder for the next group of people. So, we're sitting at this 5%. Going forward, we are going to have to work a lot harder. I think there's probably somewhere close to 30% of the elderly who've been who've received some form of vaccination. But the other 70%, we need to be asking ourselves very hard, especially in the light of this week's reports around vaccine hesitancy. Why are they not coming forward? South Africans actually have very low vaccine hesitancy based on the report. And 70% or even at some of the best guesses, 50% of the elderly have not yet been vaccinated.
Prof, the Command Council will also have to contend with the variant, the Delta variant itself. Very little known, but of course this idea that it's more contagious, the idea that it's airborne, it really does put forward a very unsettling picture. Do we know anything more over the past 2 weeks about the variant?
So there's some very good news. The good news is that the vaccines we're using in South Africa are highly, highly effective at stopping you from going to hospital and dying of the virus. So, even one shot of the Pfizer vaccine, which is the one that's been shipped around the country at the moment, gives very high levels of protection after 3 or 4 weeks. So that's good news. The bad news is this thing is much more transmissible than the variant we had in the second wave, which is the beta variant, and then what we call the wild type variant in the first wave. And I think it's the biggest reason for why we're seeing these massive surges in every single one of the provinces at the moment. It's not good news, but it's the data that came out this week suggested that the Delta variant is actually 100% almost displaced the beta variant from the second wave. So we are looking at a virus that has mutated itself into a much more transmissible foe.
Given that reality on the ground, as I let you go, what do you think should be the ideal view on restrictions tonight?
I think it's pretty much what should have been done in March last year, which is restrictions on indoor gatherings, educating restaurant owners, bar owners, anyone who has a business that requires you to congregate indoors, and what's expected. I'm not convinced that these hard kragdadigheid sort of lockdown measures do much more. They do tremendous harm. We know that. How much good they do, I think is something we need to critically evaluate. I would spend much more time teaching people about that, and then trying to support the industry, and particularly the public transport industry, in trying to keep the public and the people working in the industry as safe as possible.
All right, we'll leave it there. Professor Francois Venter from the Ezintsha Research Group. Thanks very much indeed for talking to us.